colleagues. This is Gil Morgan, Director of OncoAlert, and Somi, co-editor of Journal Cancer, along with the amazing Vivek Subbiah. An exciting new paper just came out for ASCO 23 by Kelly Renter and colleagues, Epigenetic Aging in Older Breast Cancer Survivors and Non-Cancer Controls, Preliminary Findings from the Thinking and Living with Cancer study. The study investigated the impact of cancer and its treatments on aging in breast cancer survivors, specifically focusing on epigenetic markers of aging. Previous research has shown that cancer treatments have accelerated aging, but little is known about the long-term effects on epigenetic aging in breast cancer survivors. The study aimed to determine if older breast cancer survivors exhibited higher levels of epigenetic aging compared to non-cancer controls and whether epigenetic aging was associated with functional outcomes. As we know, cancer is commonly diagnosed in older individuals, and this is particularly true for breast cancer, with 60% of new cases occurring in women aged 60 and older. Aging is a complex process influenced by various factors, and cancer treatment can contribute to further aging by causing damage to the body. Assessing biological aging in cancer patients and survivors is crucial as it can impact their ability to withstand cancer therapy, functional outcomes, and disease progression. However, biological aging is often not evident in clinical setting and is typically measured indirectly through comorbidities, polypharmacy, or functional limitations. The study focused on several markers of biological aging, including telomere length, cellular senescence, and epigenetic alterations, such as changes in DNA methylation patterns. Epigenetic measures are valuable as they provide insight into aging across the lifespan, correlate with chronological age in various tissues and cell types, predict functional and mortality outcomes, and have potential for clinical use. Previous studies have demonstrated short-term increases in biological aging in breast cancer survivors based on epigenetic measures and cellular senescence markers. However, these studies did not specifically include older women or include a non-cancer control group. Furthermore, epigenetic markers of aging in longer-term cancer survivors more than 1 year after treatment and their relation to cognitive and physical function have not been investigated. The researchers utilized data from the Thinking and Living with Cancer cohort, which included breast cancer survivors aged 60 or older who were enrolled before systemic therapy, as well as frequency-matched non-cancer controls. Epigenetic aging was assessed using blood samples obtained at 2 points starting from 24 months after enrollment to allow for recovery. Functional outcomes, including cognitive and physical function, were also evaluated. The results showed that breast cancer survivors were biologically older than control, as indicated by various epigenetic aging measures. Survivors who underwent chemotherapy showed even greater epigenetic aging compared to controls. Among this group, a higher EEA was associated with worse self-reported cognition. Additionally, higher epigenetic age was related to poor physical function in all women. While both survivors and controls exhibited similar epigenetic aging patterns over time, Black survivors demonstrated accelerated aging compared to non-Hispanic white survivors. In conclusion, older breast cancer survivors, particularly those who received chemotherapy, exhibited increased epigenetic aging compared to controls, which was associated with worse outcomes. These findings suggest that measuring biological aging could complement geriatric assessment and contribute to guiding cancer care for older women. Further studies are needed to validate these results and explore the potential clinical applications of measuring biological aging in cancer survivors. Thank you for listening and enjoy ASCO.